In 2010, when I arrived in Cornwall, there was a big push to make sure that people with learning disabilities were getting equal treatment in physical health services. And Cornwall had done quite a lot with primary care liaison nursing and secondary care liaison nursing, but there was a gap in the screening programs that were being put out for the general population and not reaching people with learning disabilities. So we had some extra resource that we put for the next few years towards screening for people with learning disabilities, and it continues to this day.
Give yourself extra time. Use any easy read information that's available. Get to know the carers and listen to what carers have got to say. Pick up tips from them.
And be prepared to be flexible. You have to be very flexible. You don't know what's going to happen. Women with learning disabilities need you to work in a very understanding and supportive way. I think the fact that we're sending out letters that people don't understand isn't a great start. We're sending out letters with lots of words in, and lots of women with learning disabilities really struggle with reading.
And fear of the unknown, not knowing what's going to happen at their screening, and stories that other people have told them just might put them off.
And also not understanding why it's important to go. We're asking women to go along for a test that's not particularly pleasant, and actually why would you go along if you don't understand why it's important?
Yes, loads of things. They can talk to them, explain what's going to happen, use the easy read information, there's loads available, and just keep reminding them, just reassure them.
They could also contact the unit. That's really important. Explain to the unit about the person that's going to be coming along for their breast screening. Know that it's perfectly okay to ask that person can go along and have a look first. Don't be scared of talking to people in the breast screening unit. They're really passionate about their jobs and they want to support people to go. Making sure you've allowed enough time for somebody to sit down and show you their wedding photos before an appointment, which I understand, is very difficult with time constraints, but it's just finding out the little things that are going to work to make somebody feel more comfortable. Make sure you've got radiographers that are prepared to sing people's favourite songs while they're doing mammograms. Make sure that they've maybe got time to sit and look at some photos of the lady first. Make sure that the radiographers are happy to have a photo of Noel Edmonds stuck up on the mammogram machine because one lady loves him and likes to look at him when she's having her photos done. You've just got to be prepared to think outside the box. Anything goes, really.
Seeing the outcomes that we had and seeing screening rates move to those of the general population, we felt that it was very important, in fact essential, to continue commissioning that.